Welcome to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. This episode is brought to you by Medexus Pharma, the company behind Ixinity. At Medexus, our commitment to the communities we serve enables our focus, improving lives one patient at a time. We're going to kick off this podcast with a story from James Romano, the Coalition for Hemophilia B legislative coordinator. This story highlights an ever-growing problem in the hemophilia B community around insurance coverage. Take it away, James.
As I've been going around the United States and meeting with families and the other in other organizations, I keep hearing stories, and one of them really stood out to me of a mom who was discussing her son, and her son wants to be a servant in his community, and he has had a dream, and she never knew if he would be able to realize that dream of serving his community because he has a hemophilia diagnosis. And with the advancement of treatments and treatment strategies and access to, obviously, the hemophilia treatment centers, he could pursue that service job and calling that he's wanted to. And immediately, though, once he got it, it was determined that the benefits that provided, the insurance plan that he had through this employer did not cover specialty medications. And so almost immediately, the scramble began to figure out why. And the alternative funding plans, of which we're going to be discussing, came into play. And this is seeming to expand further and further into the coverage options that a lot of families are facing with rare and chronic illnesses, that their employer, and it's a certain type through self-insured plans, are not covering these specialty drugs. So his clotting factor wasn't covered, or his treatment. And so immediately, they looked for a short-term gap to figure this out and went to the manufacturer to get compassionate product through their program. And that was denied to them. They weren't offering the prescription that of clotting factor that he takes. They did not have a free drug program to get him through because, one, he had coverage, and then two, they don't offer that type of program. So then became almost like a several month battle between the mother and the insurance company, because then they were trying to transition him back to his parents' insurance. It's not easy. It's not. He's under 26 years old, but that's not an easy process. You have to show that he's not covered through the employer, or that his treatment isn't covered, and then it was a back and forth for about 6 months while trying to obtain the coverage through his father's insurance coverage. Things have eventually worked out for him. He has his insurance. He's getting, through his father. There was a settlement to the issue between the insurance company and the hemophilia treatment center. They used their 401k to pay the out-of-pocket expenses. But this whole as an encapsulation of what's really affecting families, this is an excellent example of what's going on in America and what patients with rare and chronic illnesses are facing. And it starts now with this alternative funding plans cutting out specialty coverage. But we're looking for ways to end this policy, and so that families don't have to go through this.
I'm your host, Kai, and on today's episode, we are highlighting alternative funding plans, or AFPs for short, as you just heard in the story in the beginning of this episode. It's a new type of insurance that many members of the hemophilia B community are finding themselves under without their knowledge. And like you heard just now, they are not good, often leaving patients on the hook for all their medical bills and sometimes having to wait months for life-saving medication. So today, we are bringing on two advocates from the CHB community to help explain what AFPs are, how to recognize them, and ultimately what can be done if you find yourself underneath the coverage of an AFP. Later in the podcast, you'll hear again from James Romano, who you heard at the top of this episode, James is the Coalition for Hemophilia B legislative coordinator, who is working with states like New York and others to educate lawmakers on insurance issues such as AFPs. But first, I'd like to introduce Colette Barkhouse, who represents the Hemophilia Alliance and advocates on behalf of persons with rare bleeding and clotting disorders for over 15 years. Welcome to the podcast, Colette.
Thank you so much.
So I think what I wanted to ask you is, in layman's terms, as simple as possible, what is an AFP and what issues are we seeing because of them?
Okay, great question. Alternative funding programs offered by alternative funding vendors are version 2 of this cost containment strategy for employers. It basically is, let's find alternative ways to get these drugs covered, if possible, so that you don't have any claims, Mr. Employer. You don't get to have to pay anything for the drug. All right. And so their very first goal is these companies is to go after manufacturer patient assistance programs. Those programs are not meant to give away drug free to everyone in perpetuity. They're set up to help those people in a short-term, limited duration situation as a
Gotcha. And to clarify one thing you said before we move forward, this is a cost-saving measure for an employer with insurance, correct?
Right. An employer who's paying, as you heard Jim mention, this is self-funded employers doing this. But it's also important to know that of all the people in America that are insured, right, over 50% are commercially insured, which means they don't have Medicaid, Medicare, or TRICARE, right? So over 50% are commercially insured. And of those, nearly 70% are with employer-sponsored insurance. And they work for companies that either self-fund, which means they pay for all the claims themselves as a company, or partially self-funded. They both mean the same thing in that they don't have to follow the same insurance rules as a fully funded plan would.
Got it.
So these employers, many who shouldn't even be self-funded because they're so small, they will try to do anything to be able not to have to pay for these high-cost specialty drugs.
Sure. So it's not, I guess when you say that, is it malicious on the employer's part, or are they kind of getting the runaround too, so to speak?
I think it's 100% the latter of what you just said. I don't think it's malicious. I do think there's some employers out there, and be completely honest, when they hear the truth and we give them the whole kind of picture, they still don't care. But most employers are like, wait a minute, they told me nothing would change for the patients.
Okay, gotcha. So that's important to know for anybody out there as we get through this episode. If you discover you're under one of these AFPs, it's important to understand that the intent of your employer might not be what it seems as well. So that conversation will be super important, which we're going to go over how to have that conversation later in this episode.
I do think it's a challenge, and I'm sure Jim will talk about it too as an advocate. It can be a challenge for persons because they're afraid to take things like this to their employer. They're afraid of being identified as a high-cost claimant. They're afraid of losing their employment. So it is a conundrum for them. But the employers, largely most employers that are self-funded, they know who their high-cost claimants are already. So being able to have these conversations would probably be important, but we don't push anyone. We understand the delicate nature of the situation.
Sure. Yeah, absolutely. And then later on, we're going to get into how to recognize if you're under an AFP and what to do, which includes, reaching out to the Coalition for Hemophilia B. But I wanted to actually throw it over to James now, because at the top of this episode, you told this story about this family that you've gotten to know and some of the issues that occur when you do find yourself under an AFP, things like delays in treatment, lack of ability to access medication. Can you just speak a little bit to kind of the emotional impact on families that has when you find yourself in that kind of position?
Absolutely. I think the first emotion you probably run into is frustration because you're going to be dealing with the situation and dealing with, I hate to say bureaucracy, but you're going to be dealing back and forth with several I would say insurance company staff. There's going to be long wait times. There's things that we find everywhere. So I noticed frustration was really the first emotion that goes into this. I can't emphasize enough, and I know Colette would agree with me, write down every name of every person you talk to. First and last.
Okay.
Because you want to keep very accurate records on these type of. I mean, this is for any transaction you have with an insurance provider.
Jim, I would also jump in here to say that's a brilliant point. document, write down the dates, the times, who you spoke with. But if you can try to get things in writing, like follow back up with an email stating the points you heard and have them respond, to that. So it's in writing, that's even better.
Gotcha. Okay. Jim, I guess, the frustrations and, we're going to talk about what are the red flags to recognize an AFP here in a little bit, but I think ultimately it seems like if you have one of these rare conditions and you find yourself under this, really restrictive type of plan, are you ultimately having to leave your job? Is that ultimatum?
That's an interesting point that you bring up. A lot of people can't leave their job.
Right.
And I think so many, I would say a majority to a super majority of the rare and chronic community just figure out a way of making it work. Mm-hmm. And I think they're used to doing that over many years. Now, I'm not saying that's the right thing to do, but I know, and I know Colette has said this many times, and I've been with her, when you try to say to a HR department that you're going to lose some quality people, their response generally is, well, that's just the way it's going to be.
Yeah.
They're not changing the policy. That's why I think that, this is why one of the reasons I respect Colette so much. She's gone, through every, she meets these people head on and asks these questions of HR departments at national conferences and at national insurance meetings, and brings their perspective back to the patient community, so that we can really learn that and change some of our tactics. But
right.
Yeah, and I would say, Jim, let me jump in here because that's such a good point. I call it my flanking maneuver. I want to know what our opponents, if you will, are doing, so that we can actually prepare a response for it. But I tell patients, rather than go, because not all employers are holistically going to do the right thing. Some will, some won't, as you've heard us say. But for those, there are some who just want to cost save. And once they find out, they still don't care. So if you go say, I'm going to have to quit, then they're not going to be necessarily that upset. So I prefer patients tell them, I'm going to be forced to go to the emergency room or the hospital every time I need an infusion. That cost of care setting is far greater to them. Right. And I talk about when I'm talking to these employers and insurance folks, and I will tell them, be careful do not roll these out as a one size fits all option. When they're high cost disease patients like chronic diseases like hemophilia and rare bleeding disorders that we serve, these patients, it's life and death. So if you put a barrier in the path of them getting their medication, they have no other option. It's not like they can avoid their acne medication. This is life and death. They're going to go to the hospital. And that's going to be a big unintended consequence to the employer as well.
Of course. So I guess what I'm hearing is through your work, we're finding the language to use for members of the community to use when they do find themselves in this situation. So I guess that segues into, the next thing I wanted to ask, because from that story we heard in the beginning, often you don't even know that you're under these AFPs until all of a sudden you're getting these massive bills or your medication is being held up in some dispute. So what are the red flags out that the Coalition for Hemophilia B community should know about to kind of help point in the direction of maybe that they might be under an AFP?
I'd say the first one is if the patient is being told that you have to apply for manufacturer patient assistance program, you have to provide your income tax return, your pay stubs, you have to sign a power of attorney. Those are all big indicators that it's an alternative funding program, as opposed to you can use copay assistance, but it no longer helps count to this is different. This is you have to apply.
I'm signing things is there any gut to that for you? Because I know I've been scammed before, for example, a utility bill. People asking for your billing information. Is there anything specific that's being asked of, or is it more sign these things without reading the fine print?
No, they're asked them to fill out the manufacturer patient assistance program forms, which some of them are multiple pages, and they have to attest that everything they put is correct. And patients have been put in the position where it'll say, for example, enter your household income. And the company that's doing this will tell the patient, only include your son's income. because he's not on your tax return. But the form actually says every relative living in the household. And so but they have to attest to this. So that's actually asking them to commit a lie.
Right,
and it's putting patients under this kind of duress. And then signing over
probably being bullied a little bit is probably in there too.
Right. Signing over power of attorney, having to prove your pay stubs or income tax returns. There's people who've had their identity stolen, and they simply just do not feel comfortable signing over any limited power of attorney, be it however limited, and having to show that kind of documentation is simply not something they feel comfortable with, but yet they're left with no option. You have to do this or you're not getting coverage of your drug.
Gotcha. So yeah, again, going back to that bullying comment, it feels like your gut's telling you something. You're signing all these things you don't understand. You're being asked to lie. So like, keep in mind, like, these are the red flags you need to look out for if you may be under an AFP. So I guess that kind of will bring us into a way to wrap this up would be, so if I suspect I am under an AFP, what should I do?
So I would say reach out to the folks for Coalition for Hemophilia B.
Okay.
They're advocating on their behalf. Their chapters, their providers. The providers are generally involved in this. They're finding out. Mm-hmm. But I think that the Coalition for Hemophilia B, they're very attuned to what's happening here. And then, not everyone has every answer. I don't, Jim doesn't, but we have the community of each other. We go where we need to help them get the resources.
Yeah. And the perfect entrance for James here, who is the legislative advocate. Did I say that correctly, Jim?
Yes, absolutely.
Okay. So Jim, what is your role in helping people navigate this process?
My role is, and the Coalition for Hemophilia B, they are part of a coalition that Colette actually runs. So we follow what's going on through her coalition. And then we've been educating, since we're based in Manhattan, just sitting down with right now, since there's no consensus, like there's no bill in Congress right now that will ban ban this process. And I know Colette's been working very closely with the Biden administration through CMS to try to get, some regulations to, put some guardrails on this process. If not, have them ban the process, which I would love to see. But and that's not going to happen right away. It's going to be incremental. But we're sitting down and starting to educate lawmakers, because I would say that there is I think that very little knowledge of this going on right now with the legislators. None of their staff are going to face this because they have, the federal plan, which doesn't have a lot of these restrictions that the rest of us go with. I was a Capitol Hill staffer for 4 years, and my wife, to this day, 25 years later, says, God, that was the best insurance we've ever had. And so it's actually educating these staffers that this is what Americans are going through right now.
Totally. Yeah.
And it's also educating our patients, because, I think, and I know I'm one of those naive, when the Affordable Care Act passed, I thought our battles were over.
Right.
Boy, was I wrong.
Yeah.
I mean, like, I was a naive 20, 30-year-old person thinking, great, we have the ban on the exclusion for pre-existing conditions. In those days, that's what I was working against, because I worked for a patient assistance organization that couldn't pay premiums, and because a person was uninsurable. But since then, it's this constant, and Colette is a general in this fight. I'm a private, but a constant battle by the insurance companies to I don't want to say claw back from our hard-won victories, but to at least make them as palatable to themselves as possible. I understand they're for-profit companies.
Yeah.
It's always going to be, and people with chronic and rare diseases are going to be more of a drain on their resources, and they have to make a profit. But it is a constant battle, and I always think we're a ping pong as the patient between the manufacturers who manufacture these treatments and the insurance companies who want to cover them.
Yeah. And it's a couple things that leapt out to me. There was this idea of the uninsurable, right? It's like sitting with that concept. It removes the human element of everything we're talking about. But really, the importance of community, which is what this podcast and this series is all about, is how we can connect, how we can all learn from one another. So, listeners out there, use this as a resource to make sure that you're advocating for yourself and you're discovering if you are in fact underneath one of these AFPs, and lean into the Coalition for Hemophilia B as a resource and listen to your gut. If something feels off, reach out. Someone like James is on the other end ready to help you, someone like Colette. So I guess, were there any quick parting words from you, Colette, before we get out of here? Maybe one thing someone can do today?
I would just say thank you for allowing me to be on this call. I'm not sure that there's one thing you can do other than, pay close attention when you get notifications from your employer, read through your plans. If you don't understand it, send it to us, send it to the coalition, send it to your, chapter, because there are people out here willing to help you understand. So
great.
Thank
Fantastic. Yes. Thank you, Colette, for all your work that you've done to date, and James, for you as well. And, that wraps up this episode. This has been Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. For more information on upcoming CHB community events, like I just mentioned, the importance of community, just go to hemob.org and click on Get Involved, then Upcoming Events. And thank you to our guest, Colette. Thank you for being here.
Thank you.
And thank you to our guest, James, for being here. Thank you.
Thank you.
All right. Until next time, everybody, take care. This episode is brought to you by Medexus Pharma, the company behind Ixinity. At Medexus, our commitment to the communities we serve enables our focus, improving lives one patient at a time. This episode of Boundless B, the Hemophilia B podcast, presented by the Coalition for Hemophilia B, is made possible in part by the support of CSL. We thank CSL for their continued commitment to the bleeding disorders community. This episode of Boundless B, the Hemophilia B podcast, presented by the Coalition for Hemophilia B, is made possible in part by the support of CSL. We thank CSL for their continued commitment to the bleeding disorders community.